giving back to the Yes, and we are also going to record this session from now until around 7. We are estimating 1 hour or so. Tukienda sana, just give us 1 hour, 15 minutes max. So it won't take much of your time. We will be recording this session. It will be available for all that will need it later on, just to go and refer, because trust me, here we get amazing wits, we get information, and we learn and grow together. So I'm glad we are going to have this session. Karibu sana, Madam Maureen. I don't know if you have something to say. Just say hi to the people before we move to the next panelist. Yeah.
Thank you so much, Zaitun, for that wonderful introduction, and good evening to everyone. It's such an honor and a pleasure to be here. I look forward to the conversation. I look forward to sharing with you, and also look forward to learning from you. Thank you.
Oh, first one of few words. I saw your presentation. It wasn't that brief. Maureen.
So I thought we just doing the introductions first before we do the presentation.
Yeah. Okay, no problem. So yes, let me move on to our next panelist. This is Dr. Eliud Mwangi. He is CEO of Kenya Institute of Public Health, KIPH. And he has amazing titles over here: MD, MPH, PMP. He's an executive coach, ICF, PMI authorized training partner, and instructor. So Dr. Eliud Mwangi is a seasoned global health leader with over 20 years of experience, excelling in strategic leadership and program execution in international NGOs. So throughout his career, he has successfully managed over 50 projects with a dollar value of more than 200 million. That's nice. In his previous role as country director for Elizabeth Glaser Pediatric AIDS Foundation, the EGPAF Kenya, he expanded the organization's impact through implementation of multiple projects and contributed to shaping national health policies, advancing digital health technologies, and supporting HIV epidemic control. So Dr. Mwangi is the founder and CEO of the Kenya Institute of Public Health, an organization that is dedicated to develop effective, world-class, value-based healthcare leaders and strengthen public health systems across Africa. So a dedicated coach, a mentor, he has also developed numerous health leaders who continue to drive impactful health programs at national, regional, and global level. Welcome, Dr. Eliud. Can you say hi to the people as we proceed?
Yeah, hi to everyone. Very good to see you and to co-host this webinar. Very excited really to bring project management home in the health sector and also in the NGO sector, where I have really worked for many years. And I really saw the importance of project management certification. Look forward to engagement this evening and this morning for those who are across the Atlantic. Thank you so much.
And Dr. I know you've been a major influence, especially in the health sector. To be precise, you've dealt with AIDS cases. And I know you have a very interesting story of how you started out in this leadership journey in the health sector. And I've seen there's actually been a raise. There's a report on social media that has been going around. There's been a raise in HIV and AIDS infection of late, and also in December, we've seen people have we've run out of ARVs, we've run out of protection against sexual infections and everything, the condoms. So it's something that probably you can also talk about. We've seen it on the roll on social media. Probably you can let us know your take on this. And it was during the December holidays. So probably what brings out this kind of happenings during this time?
Maybe I will only say that it is still what we are discussing today, because if you plan your projects well, everything is about a project. So, and in project, you think about procurement, you think about the budget you have. So when you start seeing stocks getting out, then it means these project management practices and disciplines are not being put in place. And that's why we are here, really to have this discipline well ingrained in the health sector.
Great, great. Thank you. You'll address that more when we get to your presentation as well. And I can see Dr. Njeri has joined. Welcome. And Dr. Njeri S. Ngacha, PhD OFS. He's Assistant Professor, College of Business and Technology, Northwestern State University of Louisiana. So Dr. Njeri is a Computer Information Systems Assistant Professor at Northern West State University of Louisiana in the USA, specializing in project management and information management systems. So Dr. Njeri holds a PhD in project planning and management from the University of Nairobi, a master's degree in project planning and management, a postgraduate diploma in monitoring and evaluation, a bachelor's degree in business information technology, and 2 diplomas in community development and website design, respectively. Dr. Njeri has further enhanced his expertise with certifications in artificial intelligence, computer and mobile gaming application development from the University of Louisiana Systems, USA, cross-cultural, political, and civic organization from Meridian International Center, USA, qualitative data analysis and grant writing from Malawi University and Kenya Sign Language University of Nairobi. So he's also a former University of Nairobi student, fellow under the Problem-Based Learning Innovation Fellowship at C4D Lab, a global initiative that was supported by UNICEF, Botna Foundation Switzerland, Uber International, and other key innovation industry leaders through 5 universities: Aalto University, Finland, University of Nairobi, Kenya, Makerere University, Uganda, Dar es Salaam University, Tanzania, and this school in South Africa. OMG, we have a geek here. All these degrees, diplomas, a jack of all trades. Karibu sana daktari. Let's hear from you. That was a mouthful, by the way. I don't know when you started learning.
I started a long time ago, and sorry for joining late. I had a class that was running from 8 to 9:15. It's already 9:11 here. I had to keep my class short of 15 minutes, but my students do understand and they'll be joining this session. So I'm glad to join you. Good morning and good evening back home. Thank you so much.
Good morning to you, and thank you so much also for being considerate and for your time as well to join in. We are looking forward to also hosting the students here. I know they learn a lot, and I think that is enough of the introduction, because I know time is not on our side. I can also just give time to our first presentation, but I know you've heard me mentioning about PMI, PMP, just in case you're wondering. So PMI, Project Management Institute, is the organization that sets the standards, provides education, and administers certification in project management. So not only in health, you can see even Maureen is from finance department. So there's a lot that we cover project management in every sector. And PMP is now one of the most prestigious certifications offered by PMI, signifying a high level of project management expertise. And that is why we are here today to learn a lot from these experts. And without further ado, I'll have our first speaker, taking the stand. So let me start with Madam President. Ladies first. The floor is all yours.
Thank you so much, Zaitun. I agree. We do have geeks in the room.
I know.
Dr. Eliud and Dr. Jerry. It's such a pleasure to be in a room with them. But yeah, thank you so much for the honor. I wouldn't spend so much time on who we are as PMI. I think Zaitun has covered it quite a lot. Maybe just to add that we are a local chapter of a global organization that has over 700,000 members across, and we have around 300 chapters internationally. We are responsible for making sure that we promote and advance the profession and science of project management in our country, PMI Kenya, providing leadership and fostering the community among practitioners. Then our vision is to make project management a national competence, right? And I think that's part of the reason why we're here today, partnering with the health sector and the NGOs. We need to make sure that as a profession, anyone that wants to practice project management is highly equipped and has been given the skill that they need to actually deliver projects. Some of the things that come with learning and as you can see the profession in this room is that you're able to deliver things more efficiently, more effectively, and most importantly, just ensure that you derive the outcome that you set out to do. And that's what we're trying to do. Our core values are around integrity, making sure that we're inclusive. That's why we're including all the other industries, from people in the built environment. This would be engineers, architecture. We have people in the health sector. We have people in technology. We have people in the education sector, like Dr. Jerry, as is mentioned. And that's what we're all about. In addition, we want to make sure that we're professional in what we do. And sometimes it breaks my heart when I see a construction building collapsing when it had professions, around 5 professions, the civic engineer, the architect, the designers, the project manager on site. It means we're not adhering to our ethical codes and all that. And that's part of what we're trying to entrench as well. And then ensuring that we're able to collaborate whenever we're delivering an initiative, and make sure that we give service to our members. So that's one of the key core values. The next slide speaks to our strategic focus, which I have talked around about. Maybe just to add on how we plan to ensure that we deliver on our mission and our vision, and maximize project success to elevate the world. So we're not just focusing on delivering initiatives just for ourselves. We're thinking about how these initiatives can be sustainable for the world. And we do this through the 3 pillars. We promote project management knowledge and standards. And part of what we do here is through webinars such as this one, making sure we're working with people to do research papers, making sure we're offering resources through our websites and many other articles. Then we also do collaborate with the authorized training partners such as Eliud, who's just joined us recently, to make sure that we're able to offer this competency to practitioners. Then we also empower our professionals to make sure that they can turn their initiatives and their ideas into reality. And then we're trying to also entrench the project management as a competency for business results. When you look at organizations, you have subject matter experts in every field. For example, you have someone in finance department, you have someone in technology, etc. The project manager, their role is to bring all these pieces together whenever you're delivering an initiative. That is their core responsibility. Their work is to keep people honest, keep people focused on the target, keep people focused on the quality, keep people focused on delivering on the scope. And that's what the value that we bring to any organization. Then when you look at the dockets that we are using to run the organization, we've got the president docket, which is myself, the face of the organization, and my role is to make sure that we're working to come up, partner with strategic partners that are like-minded and want to improve our country and delivery in this beautiful country of ours. Every day you get to see that the people are demanding for better service. And through project management, we believe that we'll be able to influence success in delivering of services to our people. Then we also focus on social impact. which is giving back to the community, CSR, you will see a lot of work that has been done by the Project Management Institute Kenya to plant trees, to give back, to build libraries in Kajiado, for example. So that's also part of us giving back to the community that we live in and to make this world a better place. And then lastly is around governance, to make sure that people are, there's some ethic and some guardrails to make sure people are actually living within that. Then we have the education and professional development. And through this docket, this is how we're able to run our education program. We're able to empower individuals. We're able to share this competency. And then we have the membership, which is how we grow the profession and grow this association of like-minded individuals. So anyone who's involved in project management, in whichever industry, this is your home. This is how you get to work with like-minded individuals, to learn from them, to network, and to grow your community, to grow your business. And then lastly, we have the communication, marketing, and ICT docket. This is to also promote the profession through, of course, putting the word out there. We've got a lot of presence on social media, LinkedIn, TikTok, Facebook, you name it, we are there, YouTube channels as well. And we're marketing the organization as well. I think recently in the last year, we've spent a lot of time also just putting ourselves on media. We've been on the newspaper, doing a few articles here and there, just to stamp our authority in the country and make sure that we are heard and to make sure that we professionalize. And then lastly, which is the most important docket, is volunteers. So all of us are volunteers, the entire Project Management Institute. And that's why you can hear, I work for Old Mutual, but we give back through the Project Management Institute. So it's a way of us giving back as well. So we are largely volunteer-based, and anyone who is interested in giving back, giving back to the profession, growing the profession, giving back to students who are learning, giving back to young professionals who are also trying to grow and identify a path. This is how we do it. And that's why it's largely volunteer driven. So success starts with everyone coming together, the members, the board of directors, the chapter leaders who are leading this docket, the authorized training partner that I've mentioned, and in the organizations, the senior leadership and the people managers. I'll move on to the next slide, which is around the current opportunities for project managers, just in a large shell. The good thing that when you talk about a project manager, and pardon my French, I like to say the role of a project manager is geshido. Geshido is get SHIT done. I didn't want to say the word, but get shit done. So that is what we do in any organization that we're in. Our work is geshido. And any endeavor that is temporary, that is assigned to you for you to get it done, that is your role. We expect you to take over and lead that team, keep them focused, keep them honest to deliver on the task. And a project can be anything from Fashion Week to a humanitarian event to an educational event. All those are projects. And I think you had Dr. Eliud allude to that at the beginning of this session. So it's more around empowering you with the competency, the task, the deliverables, being very clear on your milestones so that you're able to achieve those desired outcomes, so that you're able to make a difference in the world. If you're delivering maybe a sustainability climate action initiative, for example, a social impact initiative, that's able to make sure that the organization meets its high earning potential, that able to deliver on the outcome. PMs are needed in every industry. So it's very versatile. And I think it's one of those things that can be transferable to any industry. When I think about the health industry, for example, I think about the administrators that are running the organization. I don't know if that's the standard, but in my mind, I don't know those who've watched House. House is a series that ran for quite some time, and there was a lady called Kati, and her role was to make sure that every day she brings all the resources together in the hospital, make sure that we have rooms for operational procedures, make sure that we have enough nurses, make sure that we have medicine. And that in itself is a project on a day-to-day basis. How do you run that end to end and make sure that the smooth operation of the organization? So project management is something that can cut across every single industry. I'll move on to the next slide. When I think about why it's important for the project, for in particular for the health care, I think about things around when a hospital, for example, or an institution such as Malibu Pharmacy, any institution that is in healthcare. I think about when they want to implement maybe a new system for the organization. That's a temporary endeavor, so they definitely need a project manager. When they want to expand their premises, Nairobi Hospital has been doing a lot of construction. They need a project manager to help them with that construction work, to make sure it doesn't interfere with the day-to-day work, right? And to bring all the pieces together, make sure equipment is not left in the open because a roof had been removed, etc. And also when we're trying to improve patient care, more and more people are getting, and you've seen even with the demonstrations, Gen Zs, people know what, and they demand for service in a particular way. So you constantly need to keep improving your patient care, and through that you definitely need a project manager to help you with that. Then I look at things around when you're trying to ensure that if you had set out to spend 200 million to expand that facility, that is exactly how much it will cost you, not a penny more. Otherwise, anytime you go over and above the budget, there'll be other consequences, either on the schedule or we'll have a negative result on our return on investment, etc. So that is why you need a project manager, someone who will make sure that people deliver the objective, people deliver within the scope, people deliver within the budget, people meet the quality that was set out at the beginning, and that people are able to, the customer, whoever you're doing this for, is satisfied at the end. And then lastly, just to make sure that whatever you have delivered, whether it's a new system, whether it's a new process, SHA, for example, that the beneficiaries of this particular initiative are able to adopt and buy into it. Did you get their feedback? Did you, you need to make sure that you have someone who is implementing with the customer point in view, and not just focusing on the subject matter expert. So again, like I said, project management is very versatile, and the skills are transferable to anything. We have CEOs who also require and have actually a PMP certified. Then when I think the other reason it's very important, I think, for healthcare, speaks to the challenges that I think healthcare experiences. Every day, their landscape is evolving. Things are changing, technology is changing. So they always need to run these temporary endeavors. Secondly, the stringent regulation that they're constantly into, they always need to make sure that they are sticking to, adhering to the changing law, the changing regulation, etc. So those temporary endeavors will always come up, and that's why you always need a project manager, and or you need the competency of a project management to be able to run delivery or executing these changes. Then, like I said initially, people are demanding for better healthcare service. So every time you will definitely need to keep adjusting, keep adapting. If you don't adapt, you die. If you don't evolve, you die. So as an organization in the healthcare industry, you definitely need to make sure that you're keeping up with the trends. Then I think in the healthcare industry, there's also a really high risk of litigation, being sued, etc. And because of that, you need to have someone who's constantly making sure that any risk that is identified is managed. And sometimes managing those risks means coming up with a temporary endeavor that you need to deliver to fix and to make sure that you don't get caught up And then lastly, there are so many stakeholders in the healthcare industry, from the government to your patients to service providers, the technologies that you're working with. And because of that, you definitely need to have someone who's constantly taking care of making sure that you're adhering to that. And that's the role of a project manager. The next deck speaks to why PMI certification is important. Under PMI certification, and even when we run our webinars, we emphasize this talent triangle. Talent triangle is basically ensuring that any project manager is equipped with mix of having hard skills. Hard skills is your competency for running the project, the initiation, planning, those basic fundamentals, the technical know-how, and also understanding your business landscape. So we bucket them into three. We have the ways of working. The ways of working basically means, are you delivering the project through agile methodology? Are you delivering through hybrid? So those are just the competencies. And then you have the power skills. Power skills are what we used to call soft skills in the past. And this refers to a good communicator, a good leader, an empathetic leader, someone who uses emotional intelligence, etc. And these are some of the skills that we emphasize even as we are driving this competency with our leadership, so that you're an all-rounded leader. And then lastly, someone with business acumen. We've moved away from project managers just being the KYM, Kadayamoko, the person who just does the work. We moved away from that. We now also need to think to ensure that as we deliver initiatives for organizations, are we maximizing the resources? Are we strategic enough? Also making sure that we're not just delivering something for the sake of delivering it. And that speaks to that last bit of business acumen. So the next slide is just around the tasks and responsibilities that are required for you. And these are the competencies just in a nutshell. You will be required to define the scope. You'll be required to stay on schedule. You'll be required to plan the cost. You'll be required to manage resources, monitor the progress, communicate, assess to make sure that we are actually meeting our milestones. You'll also be required to troubleshoot, to resolve conflict. You'll be required to also coach the resources that you're leading, because you are the leader, you're the officer driving the ship. And lastly, you'll also be required to carry the water. And I think that's actually one of the most important things by carrying the water. Carrying the water means going that over and above your role as a professional. That extra thing you need to do to make sure that your team gets to the finish line. And it has to speak with servant leadership, which is around our other skills. Then the other skills that also go with this, apart from being dedicated, being perseverant, being passionate, you need to familiarize yourself with trends such as AI, which is a really, really big theme right now. You need to be able to be very organized. I cannot overemphasize communication. The how you speak, the how you communicate, the how you transfer the communication, transfer updates, for example. You also need to be a leader. You also need to be very familiar with project management tools and the software that we use. You need to be very flexible, and that's where agility comes in. You also need to have very good people skills. And I think lastly, there's a sense of humor. Don't take things too personally. Sometimes things don't go right, and that's the nature of project management. So it's more around taking it in step. And lastly, these are some of the certifications that we offer, the Project Management Institute, and what Dr. Eliud will be offering as the ATP. We have around 16 certifications, and the levels are based on the experience. I'd speak to maybe one in particular, which is the PMP has been the hallmark of project success since 1984. It's one of the oldest and one of the most recognized. It's a gold standard. So generally project management certifications are gold standard. What do we mean by gold standard? It means that they are acceptable globally. So your PMP in Kenya is the same PMP in Dubai, right? And that's what makes it one of the gold standards. And then what it also offers is it will test you and it will cover everything that you need as a professional to make sure that you have the capabilities to deliver projects. So it's quite wide. If I was to speak to maybe just additional information on PMP, is that you would need to demonstrate that you have delivered a project, and that's why it's in the middle. It requires some experience. It also requires you familiarize yourself with some of the techniques. So it's not something that you start at entry level. At entry level, you'd maybe do the first one at the top. And then there are others for specialization, including people who are working on risk, etc. So I'll leave it at that, unless there are any questions maybe at the end. It's a short exam, 180 minutes, 230 minutes, 180 questions. It's not easy per se, but statistics have shown people pass. So not to fear, and it's definitely something that everyone should definitely pursue. When we want to talk about the benefits of joining PMI. One of it, the first one would be that it gives you access to a global community. Like I said, we are global. We have global presence. Secondly, it gives an opportunity to network with other like-minded individuals and also people from different industries, and you get to learn a lot. Then through the events that we have, this year we have Kigali we are meeting in Kigali for the Africa conference. We also have another conference in Phoenix, USA. So you can imagine we've got a calendar of very many activities. So it gives an opportunity to meet with other people. Then through the workshops and the webinars such as this, you're able to professionally grow yourself. The certifications themselves are also like I said, they're globally recognized. So it's an opportunity for you to pursue learning and become a geek like Dr. Njeri here. Then it also gives you an opportunity to have access to many other resources and tools that we use in project management, which will be given to you as just a benefit of project management. Those schedules that I was referring to, risk template, etc., all those things are found on our resource packages. And then some of the other things that you get are discounts for events, discounts for products. For example, when you're sitting for your PMP, I think the exam would be around 575 US dollars, but when you remember, it's 284. You see, that's like half the cost. So that's some of the benefits. And then other things would be opportunities for you to volunteer, give back if you believe in giving back. You also have opportunities for mentorship program, because you're able to get access to thought leaders that you can actually reach out to. Then what are the benefits for joining this as an industry? I think if you're running an organization, just the mere fact that you have this PMP, for example, it legitimizes your business, and your customers have some extra believability because of the title that comes with and the recognition that comes with PMP and PMI product. Then you have the member discount that I've referred to for anyone who is a member. Then the networking that I've talked about will give you opportunities for you to grow your business as well. Then the education that is offered, there are so many papers that are published, so much research, so much data that is at your fingertips whenever you need to. So like on our portal, you'll be able to even do simple searches such as how much does a project manager earn, so you can get a baseline, surveys on how project management is doing in the construction industry, for example, and what value you can add there. And then lastly is the awards and recognition. So through those awards and recognition, we do awards on a yearly basis, for example, in Kenya, and we ask organizations to nominate themselves on the project that they've delivered, and through that we're able to get some free publicity, free branding, etc. Maybe as I close out, Mother Teresa said, I can do things you cannot, you can do things I cannot, together we can do great things. And that's part of the reason why it's really important for anyone in a professional organization to join like-minded individuals, so that you're able to do things together, that you're able to not just do things, but do great things. And Einstein also said that when you stop learning, you die. So please don't die. Please make sure that you're constantly improving yourself, constantly growing your skills. I think that brings me to the end. I will share my contacts so that anyone who has questions and would like to reach out is able to reach out to us and be able to get any information that they need on how to become a member and to join this wonderful community. Thank you.
Wow. I'm almost telling people a round of applause, that was an amazing presentation. I've captured a lot exactly on how PMI promotes, empowers, and trenches, and the main and key role is just ensuring that we deliver the best services out there to the community. And Maureen, I've been calling you here, Doctor. Hanging out with Dr. Eliud has made me call everyone Daktari, and I'm soon also to be called that. I've been like, Dr. Maureen, but it's a good thing. So thank you so much, Madam President, for that. And one thing you've even mentioned, and I about the movie that you're saying, sorry, nimesahau jina hiyo, but there's one also, a series called New Amsterdam, that also shows how that Daktari, the Dr. Max Goodwin, is such an amazing project manager. So he showcases the power skills that you're mentioning, and it's a good series to catch it on Netflix, guys. You can see that he's one of the medical directors of a big hospital in New York, actually, and he did an amazing thing. So the first thing, he went into the hospital and met his team. He was like, where can I help? So he was very empathetic and came up with brilliant solutions. So that is one thing that you can learn about it. Go and get it. And also get Shido. That is what you said, Maureen. Make sure you get shit done. Stick to the budget, and we captured that. We captured it, by the way. So I have my own skills. I'm not good alone. You have yours. We come together and we make success. So there's amazing people also in the room, not in the panel. We have like 89 attendees. Milka Juma, I can see you. Joanne, I can see you. Faith Wafula, Francisca, Frederick, Eric, Lewis. Oh God, you many guys. Thank you for tuning in. Ini mambo ya TV. Thank you for joining the space. And as we go on, we also have one question. So I'm not sure if Maureen will pick this question right now or at the end. We give it time till the end, yeah? You can check the Q&A segment, Maureen. I know you can see it. Probably you can type it, but we'll address it at the very end. So right now, I give room to Dr. Njeri to do his presentation. Remember, we have 20 minutes each for each panelist. You can see time is running by so that you can get time to do the question and answer. Thank you so much, Maureen. Dr. Njeri, let's do this.
Thank you, Zaitun. I'll take less than that time because I know these notes will be sharing with Dr. Eliud, and Dr. Eliud will be sharing with participants afterwards. So I think the essence of this presentation, first of all, is to coalesce our thoughts and our minds towards why should we pursue project management, or why should we go for these certifications. And the reason why Dr. Eliud came up with this platform and invited all the exciting presenters and moderators like Zaituni and Madam Maureen. I think the participants will have much to do even after this webinar. So I'm not going to take 20 minutes. I'm going to take less than that so that I share these power decks with Dr. Eliud. Then he can be able to bring them together to the participants afterwards. Allow me also to mention this. I know Maureen has used some abbreviation like GIGS and KYM. For the purposes of our international students, kindly you will elaborate what is this KYM and what is this GIGS, Zaitun and Maureen you are all talking about. Anyway, that said and done, I want to share my power decks. And for our students who just joined us from this other end, I know they're excited to learn much about the culture back home. And for those who are back home, I know this is also a platform for you to network with international students. So kindly take advantage of these opportunities.
Daktari, you can give them a shout out. Your
Uh,
students. Just mention.
Oh, yeah, sure. You mentioned about Levi,
Yeah.
our students from Northwestern State University. Thank you so much for logging in. I'm so happy about you. I've checked your names down there and you didn't let me down. So thank you so much. And I'm so happy that you're also engaging with the participants in Nairobi, Kenya, in Africa. I also have some representatives from UNICEF. I know Dr. Yes, I've seen Dr. Migosi and I've seen Dr. Lokenga from Jakarta, UNICEF. So these are people who are making this webinar look more international, and I'm so happy about this. And I've also seen Cheruiyot. These are folks who are making our hearts feel like we need to do this many times because this is now an international platform. I can't mention all the names. I've seen even somebody, Gichuki. Gichuki is an electrician, somebody who is well known and doing a lot in terms of projects of electricals. Anyway, without much ado, let me take the least time possible and then I bring back the mantle to the moderator. Let me share my notes here, kindly. Yeah. And as I do share my notes, I've seen Cheruiyot ask a question about the program and project. By the end of this presentation, Nelson Cheruiyot, your answer will be halfway answered as Maureen prepares a more deeper answer than probably more I can provide. So when you talk about the project
Sorry,
management,
Daktari, just before you continue, let me just mention the question now that
yes.
you've prompted it because people can't see it. What is the difference between project management and what is the difference between project management and program management course? And which one do you recommend for medical professionals? So that is the question as Maureen is preparing to answer it. Thank you. Go on,
Thank
Daktari.
you. Thank you, Zaitun, for that. So when you talk about project management, I know there are three categories of how projects can be illustrated. There is the project, there is the program, there is the portfolio. So the three, they all mean the same, but the only difference is the diversification. When you talk of diversification is, if I give an example like Thika Superhighway is a program. Thika Superhighway being one of the highways which were built in the Kibaki's era is a program because within that Thika Superhighway program, there was somebody who was dealing with lighting. There was somebody who was dealing with drainage. There was somebody who was dealing with the carpeting of the road. So like the lighting, the electrical bit could be a project because it's a standalone. But the electrical bit, making sure the Thika Superhighway has lit or is lit, that project itself informs to the bigger superhighway program. So then the program goes to portfolio. Like we have several superhighway being built, like the Nairobi-Mombasa superhighway, the Nairobi Expressway connecting Nairobi to JKIA. So if you bring all those infrastructure programs together, they form a portfolio. So a portfolio is relatively bigger. After portfolio, you come a little bit down, programs, and then programs, projects. Then I leave the rest to Maureen to break it down. So allow me to just take you through the importance of project management. And when you say the importance of project management, remember, project management plays a vital role in Africa or in the global development. So this helps organizations to effectively plan, execute, and deliver projects. By the way, when you talk about project management, there are very technical terms which we should all of us understand. First of all, we know we have the 10 knowledge body areas. When you talk about the project management, 10 body knowledge areas, from integration, scope, schedule, communication, risk, quality, and to the last one, stakeholders. Those are 10 body knowledge areas. One can take either of them and become a profession in either of those 10 body knowledge areas. Then also we have the 8 domains. When you talk about the 8 domains, from the stakeholders, from the project team, from the project delivery, to the last one, risk and uncertainties. Again, that is an area one can take. And then finally, we have something we call the project management processes. There are 5 of them. We have the initiation, monitoring and closing, monitoring and controlling, and then closer. So those technical terminologies, they should help you know for sure where exactly one fits. So when you talk about project management, helping us to plan, execute, deliver projects that drive economic growth, this helps every profession or every other sector like infrastructure. When you talk of health, education, when you talk of something like to do with social services and such stuff. So I wanted to share with you some key importance of project management in Africa. And when I talk of Africa, I'm not leaving the global platform in isolation. So it should be project management in the context of global development. So let's check some of these. And when you talk about the 10 points, remember, the world is compartmentalized into blocks. Like we have the regional blocks. Like in Africa, we know we have the 8 blocks. We call them the regional economic communities. When you talk of the African Union, or when you talk of the Agenda 2063 of the African Union. So you'll find there is somebody in charge of infrastructure. When you talk about the 8 blocks of Africa, we have the Arab Maghreb Union. We have the COMESA. COMESA, that means Common Market for East and Southern Africa. We have our Eastern African, you know how it's called? It's called the Eastern African Community. When you go south, we have the Economic Community of Central African. And then we have ECOWAS, we have IGAD, and then the last one, we have the South African Development Community. So these economic blocks are organized like in a project. And you'll find in every block, there are a series of projects that are being run. That's why project management is a profession which every one of us has no choice but to go for it. And this is the catch. The only way you can catch up with this development is doing a certification. And a certification will help you to be recognized globally. If you do a certification like PMP or CAPM or maybe Scrum Master, you will find whether you do it in Nairobi, Kenya, it will be recognized in Australia. It will be recognized in the US. So they're not going to send you back to school and tell you we need a certification that has been done in the US. You will find a certification done through the Kenya Institute of Public Health and maybe Dr. Eliud. That certification will be acceptable in the US. It will be acceptable in the UK. The only difference is which certification are you doing? For instance, in the UK, I know they normally like doing the PRINCE. That is the project in controlled environment, PRINCE 2 or PRINCE 1. But when you talk of PMP, that is the top echelon, And all these 10 areas, the certification will help you understand and run them like nothing less or nothing more. And then the other thing I needed to mention is about the benefits of this organization in terms of project management. So you will find that once you build your capacity, then your skills can help you work anywhere in the world. And again, when you pursue some of these certification, you find yourself working with international projects. We know we have international projects that are funded by World Bank, that are funded by International Monetary Fund, that maybe African Development Bank, those Bretton Woods institutions, the World Bank, IMF, and such stuff, and even Bill and Melinda Gates. And we have so many other who helps maybe fund those developments. So if you invest your skills correctly, you find you foster a culture of transparency, And you are not going to have these white elephant projects, which start and along the way, they fade away or they die. So that is one of the benefits. And then the other thing I needed to talk about is the African Union Agenda 2063. I know I don't have much time, but because I'm going to share these notes with Dr. Eliud, kindly, this will help anyone with an intent to work with an international non-governmental organization or an international company or an international institution to understand exactly for the next 50 years, where are we heading as a continent? Where are we heading as a global platform? And this will help you now know where to fit within those gaps which have been identified. And then finally, there is the aspect of the Sustainable Development Goals. When you talk about the SDGs, from goal number 1, ending poverty, to the goal number 17 of partnership and linkages. So those again are areas which can help anyone with an intent of doing a certification to know exactly where they want to fit. So without much ado, let me just wrap up this by mentioning 2 things. These notes, you're going to read them afterwards because I know we don't have much time. Projects are only categorized into 2. It's either you're doing the traditional waterfall or you are doing the current one, the agile. And when you talk the agile, many people confuse. Agile is the mindset. So whether it's the Scrum Master, Kanban, whether it is the development operatives, development security operatives, whether it is something to do with SAFE, those are agile. But when you talk of the traditional projects, we are talking of the big design upfront, the traditional way of doing things, like following stage 1 to stage 2, where the risk is too high. So the certification will help you gather momentum and help you figure out where you want to land now and in the future. So with that said, allow me to pull my slide decks, share them with the moderator, and then the moderator will figure out how to share with the participants so that we have much time to engage those who are in this platform and also share much more with those who are willing to work with us now and in the future. So thank you so much, and back to you, Zaitun.
Wow. Thank you, Daktari. That was very brief and straight to the point, very clear as well, and informative. I don't know, where are we landing? Traditional waterfall, or is it the agile? I love anything to do with mindset. It needs to be positive. It needs to be, you can adapt easily. So for me, I'd say agile, but I'm here to learn even more. And as we continue, yes, we will share each and every presentation done with all the panelists. Sijali. Do not worry. Daktari, do your students understand Swahili?
They honestly they don't, but they
They
could be learning.
don't.
They could be learning through this platform.
Okay. Let me withhold the Swahili to that point. Yeah, but that is good. Thank you so much, guys, for also keeping on joining. We are at 92 participants. This is a good number, and 93 to be precise. And keep the questions coming. I can see we also have 3 questions aligned. The other 2 are anonymous. Why are you hiding your names? I'd like to give you a shout out here, but we'll address them. So one of them is saying, hi, thank you for the webinar. Very timely. One of my career goals this year is to get into PM as a healthcare provider nurse. So where do I begin? Daktari, you'll answer that as we go. And also, please share these slides with us through SCAF Kenya group. We will actually do that. Also, Dr. Eliud mentioned that he has a platform whereby we are going to talk about it. We're trying to build a community from this, and we'll be able to share all the valuable information. So don't you worry. Keep tuned. And right now, I want to invite Dr. Eliud as he winds up the conversation with the last presentation. This one is going to be a heavy one. I know. I saw the slides. I saw them. He's well prepared, guys. He is well prepared. Karibu sana Daktari, CEO KIPH. Yes, Karibu.
Yeah, thank you so much. I'm very humbled and honored to have all of you. And I'll just jump straight to the presentation. Kindly keep putting your questions on the Q&A so that we can, at the end of it, we shall answer all the questions that are there or follow up after that. So I go to the next, sorry, the next slide. I think I've already been introduced, so I'll go straight to the next. Yeah, so just to introduce, Kenya Institute of Public Health is an institution that was founded way back, but we are now offering internationally accredited professional healthcare, certifications, mainly for people working in the healthcare sector, professionals in the healthcare sector, and also NGO sector. This does not mean only doctors or nurses or clinical officers. We are talking about professionals mainly in the niche of healthcare sector and also NGO. Our mission is basically to develop effective, world-class, value-based leaders through training, coaching, and mentorship. And we are a premier authorized training partner with Project Management Institute, offering those certifications that my colleague Maureen has mentioned, but also doing more things like coaching. We are doing leadership coaching. We are doing public health evaluations and various consultancies. But today we are only going to, take our time more in the PMP and also CAPM, that is Certified Associate Project Management. We are an accredited institution by PMI, and that's our badge. When you are certified, you receive a badge like the one you see here, basically to show that everybody that, to show as a proof that you have been certified to offer these PMI certifications. About myself, and just, in a very short way, just say that I have been in this journey for about 20 years. I have been able to run many projects, but really just to say that what really motivates me to do what I'm doing now is because of the steep learning curve I went through as a trained medical doctor with very minimal project management skills, with very minimal management skills or leadership skills. And I was actually thrown at the deep end when I joined the NGO sector. And that is why after the running a lot of ropes and now being able to run many projects, as you have seen, I have been able to manage over 50 projects, over 200 million USD. There's a time I managed about 14 projects simultaneously. And this was only made possible because of going through project management professional training or attaining my PMP, which helped me really to be able to now utilize these principles and this practice really to be able to manage projects, because everything is about projects, as you are going to see. And I am a trained, I am an ATP, authorized training partner instructor, as you can see there. I will not go so much deep in this because we shall have enough time to discuss what project is. And I know my colleagues have also mentioned, but a project is a temporary endeavor that's undertaken to create a unique product or a service. And that's why everything is a project, even including our lives. Projects drive change. So anything that you do that is supposed to give you a change from one level to the next, that means that you're implementing a project. If you're running an organization and you have a strategic plan that shows the current state, and then in 3 or 5 years, you need to reach another future state, then in between there, you need to implement many projects. When you look at government, for example, when they have budgets, basically all that budget's about projects because they need to implement projects really to achieve whatever they need to achieve. So everything that we do is basically about projects, and that's why project management is very critical. We're also saying that now we are redefining project success, and this was just a research that was done involving about 55 questions, over 10,000 participants, and very many interviews were conducted. And this is just saying that we have now moved from defining success of a project using the triple constraint triangle, where we are just saying, as long as a project has met time, cost, and scope, then it is successful. This is no longer enough, because you really need to now define success based on the value this project is giving to your stakeholders, based on the effort that you have undertaken, and the expense, which is the cost. And after all this research that was done, it was clearly shown that the global net project success is only at 36%, meaning that very many projects defined this way do not succeed in terms of meeting the stakeholder expectations. And that's why we really need professional project managers to run projects so that we can increase this global project net success score. And these ones cuts across, as you can see there, right from industrial construction. You can see where healthcare is. But if you're totally look from the bottom, you can also see we have consulting, government ranking very low in terms of project success. And what we are trying to say is that we must ensure that whatever we do, we have a very comprehensive way and systematic way of doing it. And that is what PMP or the other certification brings. So that as you do your projects, you ensure that they are successful. And in healthcare, you know that successful projects means that really you are talking about of life saved. Project management is how you apply all these tools, all these skills, all these techniques to project activities to meet project requirements. And I just like saying that, I mean, when you are a project manager who is certified, you have a lot of tools at your hands. Just like a mechanic, for example, has many tools to do his trade, a project manager has so many tools, as you are seeing there, to help you achieve whatever you need to achieve. But when you don't have these tools, you are like a mechanic without, a spanner, and you are trying to change a wheel. You can just imagine how difficult that is. And that is why when I attained my PMP, I was able to run many projects. At some point, I was running 14 projects at the same time as a country director with my many managers, because we are applying the tools that are very well defined, and we are really able to manage these projects very successfully. And therefore, the importance of project management is really to meet business objectives, satisfy stakeholder expectations, all the way to responding to risk in a timely manner. So we really need to be professionals in this area. In terms of what is PMI and PMP, I think we have discussed quite a lot. I really want to jump this slide because my colleagues have alluded to this. But I really want to say that in terms of PMP, which I will take a little bit more time, is a gold standard certification in terms of project management. It shows that you have ability to lead projects in any industry with this globally recognized certification, and it opens the door to a world of opportunities. The project management professional certification acknowledges candidates who are skilled at managing the people, processes, and business priorities of professional projects. So we are saying that these are cross-cutting certification across industries. But I'm here as a doctor, as a medical profession, saying that we need more people certified in project management. Because in health sector, in NGO sector, there is so much that we need to do. And this skill set will help us to deliver in a more systematic and more successful way. When you have PMP, it has been shown that those people with PMP, they earn higher, over maybe 33% higher than those without PMPs. And we have quite a number of PMP holders across the globe. And these ones now you form a community when you join or when you become certified. And therefore you are able to relate with them like we are relating this evening. The path to PMP certification, the first one is to ensure that you meet the eligibility The second one is you complete the application. For that is application for the exam. Then you pay and schedule the exam, study for the exam, and then take the exam. But today I want to talk about the first stage, which is check the eligibility, because that's why we are here today. If you look at the various requirements, and because most of us are in category B, you need to have a bachelor's degree or higher for you to be able to take this PMP certification. Then you need at least 3 years, more than 3 years experience leading and managing projects within the past 8 years. And then the most important that we are discussing today, you need 35 hours of project management education or training by an authorized training partner as Kenya Institute of Public Health. And that is why we need now to take this training, so that only when you do that, that is the time you can now be able to register for exam. And that is why, as you'll see, that is the first training that we have called for, which is we're having the cohort starting the training on 3rd of Feb. And I believe most of us will be able to join that training. Why PMP? I think I have already mentioned about the community. The certified managers are highly sought. PMP is a proof that you have the right qualifications. Majority of the projects fail, as you have seen, and you earn higher when you have a PMP. But what about in health sector? And I just want to spend a minute or two here by saying that the health sector is all about saving lives. Therefore, effective project delivery and success translates to more lives being saved. If it is important to have certified project managers building roads, it is maybe 100 times more important to have certified project managers in health sector or in NGO sector, because we know that we are talking about lives. A project that's not done well means that patients are dying and you are losing people. Project management skills are not imparted in majority of medical schools. I went through the whole medical school and there was nothing much training around management or leadership. And this is across the sector. And therefore, that is why we need to have this certification. The NGO sector is all about changing socioeconomic status of communities, which translates to better living standards and improve quality of lives. And therefore, in the NGO sector, everything is about projects. And there are a number of people who keep asking me, how do I join an NGO, the NGO sector? And my question is usually very simple. Do you have the right skill set? And the beginning point is for you to be certified as a project professional. And now more and more organizations are now demanding project management certifications for management and leadership roles. I was perusing a few, job adverts, and I have come across a few who are really saying some are straight saying PMP, others are talking about project management training or certification, but others are talking about organizational skills. Are you able to coordinate? Are you able to organize? All these you are going to learn in the project management professional certification. Quickly, just to say that we have a book that is called PBOK. That's a project management book of knowledge. And you cover quite a number of knowledge areas that, as Dr. Njeri mentioned. So it's not only the triple, the triple constraint triangle, but here you are covering all those 10 knowledge areas. You cover the project cycle, and you go very deep. And that's why when you are certified, you become globally recognized. So what about the ones who are starting? Because that's the PMP, which require you to have some management experience, leadership experience. When you have just graduated, we can start this journey. Currently, like we are discussing, even with those who have just graduated, for example, being a medical doctor from medical school last year, and clearly we are discussing how do we now start with the CAPM, that's Certified Associate in Project Management, so that you don't have to run the ropes the way we did. You are able to be introduced to this project management skill set, the management side, the leadership side, so that it makes your work easier. And then finally, you grow into PMP and the rest of the certification. This one requires no experience. You just need your degree or diploma. You do exams, that is about 150 questions, and 180 minutes is exam time. And this, once you do this, you can become an assistant project manager, project administrator, project coordinator, project manager. But most importantly, you'll be able to handle your work in a better way. If you are made a med sup in a hospital, if you are made a nursing officer in charge, if you are made a clinical officer in charge, if you're in NGO sector, you'll be able to do a better job when you have this skill set, because you have the tools that are needed for you to be able to do your trade. The eligibility criteria, I think it is there. And then you need 23 hours of project management education completed before the exam. So that is the one we are offering. And then we shall be able to usher you to register for exam when you are ready, and then you attain the certification. And then once you attain the CAPM, then you don't need the 3 years of project management. I mean, leading projects and management. You can now go and then even do the PMP after that. What about the costs, the associated costs? Quickly, I want to say for PMP, the first one is the 35 hours of project management, education, and training by an approved institution like Kenya Institute of Public Health. The cost is going for 40,000, which translates to about $325 for our colleagues outside the country or outside Kenya. And this money is basically to pay for tuition, but also to provide you are going to get a portal where you can be able really to access all the learning materials, all the course materials, so that you are able really to pass your exams. And then we shall also be able to provide sample exams so that you are able to practice. And then when you are ready, you can sit for your exams. Maureen mentioned about being a member and the benefits. You can pay for this membership at any time. And the membership fee for PMI Global is $129. And then I think Maureen will also clarify for Kenya how much it is. I think it's about $20. I think she is going to mention how much. And then now, when you have this membership, you can be able also to access all the benefits that Maureen mentioned. And then once you have now done the 35 hours and we have given you the certificate, you can now be eligible. You are eligible to register for exam. And the exam is paid directly to the PMI. But when you're a member, is $405. If you're a non-member, it's $555 US. And then also, I mean, the membership I have mentioned up there. And therefore, the total costs, if you are a member, to be about $109,000 or $860 US at the end of the day. And then also a non-member will pay a little bit more. But what I really want to emphasize is that you are not supposed to pay all this money at once. You first of all start by the training. And then after that, once you are ready for exam, which I would recommend it can take 2, 3, 4, 5, maybe up to 6 months for you really to prepare well. Then that's the time you register for the exam. So the money that you need initially is to do the training or to maybe pay the membership. Then after that, the rest will follow once you are ready. For CAPM or Certified Associate in Project Management is 30,000. Is about 3 weeks training, and the same breakdown for exams about 245. If you're a member, if you're a non-member, is 280, and you can see the total costs down there. I'll share all these slides with the team here, and that's why I'm requesting my support team to put our WhatsApp link in the group so that the team who are here and they are not on our WhatsApp group, they can be able also to click it and join so that we shall also be able to continue this conversation even after this webinar. The training information, the mode of training is virtual, Zoom platform. If it is weekdays, it's between 6 p.m. to 9 p.m. for 4 weeks. This is PMP. Weekends are 9 to 1 p.m. And participants will be registered on the PMI portal where they will have access to all the training materials. Facilitators are PMI ATP certified instructors. And additionally, we have made a requirement for KIPH, where we need people who have worked in these sectors for more than 10 years. And I want to reemphasize again, it's not a matter of being that you must be a medical profession. We are saying professionals working in the health sector and NGO sector. Like one of my co-facilitators is actually somebody who is in operations, who has been a director in NGO, international NGOs, in the area of administration, operations, that's in terms of the overseeing procurement and the whole operations, so that we are able to offer the best for you. And our support team will guide you on the exam registration process and anything else when this comes up. So finally, the next steps is this webinar we are doing today. We shall have for PMP class registration start immediately. We are going to share the link where you can start now registering and paying for that class that start on 3rd of Feb. After that, the deadline for payment is 31st of January. Then we are going to put you in the portal so that you can access the materials, and we start our class on 3rd of February, God willing. The class ends on 28th of February, and then after that, now we shall continue working together until you are ready for the exam registration. For CAPM, we are going to have this starting the registration deadline. I mean, the CAPM we are going to do this in March. Therefore, the registration deadline will be 28th of Feb, and then the class will start on 3rd of March, and then the class will end on the 21st of March. So we shall be doing PMP this month. The next month we do CAPM, and then finally, if we need more classes, we shall be able to do that. So that's the end. Thank you so much. And I think we shall be ready for questions. Over to you, the moderator. Thank you.
Thank you so much, Dr. Eliud. That was really informative. And I'm sure we're also going to share the same presentation for further information. And I can see people have a lot of questions. And before I jump into the questions, we always see there's a story behind a success. And I know, Dr. Eliud, you have a story. Ile story ulikuwa unanipigia. Okay, I'm sorry. There's a story you were telling me the other day about how you got yourself into now project management and how Kenya Institute of Public Health came to being. So probably just highlight your story briefly for people to relate and see that the probability of success and the possibility of it as well. Yes, briefly,
Wow.
Daktari.
Yeah, very briefly, I usually call myself a doctor with a difference. Graduated 20 years ago at the height of the pandemic of HIV. That time we were just having patients who were just dying because there was no treatment. And I was in this hospital where we were certifying. We had many patients dying, unfortunately. I would be certifying almost 20 patients every morning. And I was like, this can't continue. So because of the pain of seeing patients suffer, but also the passion to save lives, I thought of, I have to change this trend. I need to go upstream. And my upstream was to join now the global health sector, which is basically, people know it as NGO. I joined an international NGO, that is KIPH Columbia University, as the first hire. And there was a lot that we needed to do. And that is the time I had a very steep learning curve. Just, a newly graduated doctor with zero experience in management and leadership. And then I'm now supposed to run, and I'm in an NGO, work with hospitals, work with many stakeholders, and it was not easy. And that is why now, as I continue growing in my career in NGO sector, I realized I needed more and more management training. And I did MBA, I did MPH, but it's when I did the project management that made all the difference, because I really now started understanding how do I manage these projects that I'm supposed to run? How do I deal with people? How do I deal with the stakeholders? And that is the way by God's grace, I was able to rise in that organization to the level of director of programs. Then after 8 years, I was able now to join Elizabeth Glaser Pediatric Case Foundation as a country director, where I served for 9 years and a half. And that's really where I really experienced. I was really able to practice all this project management and did a lot there. I'm also an executive coach, and I really believe that coaching, I'm championing coaching in health sector, because coaching leadership style is the new way of leading. And it's a way that we really need to ensure that we are able to achieve and be able to lead in this VUCA world, because there's so much that we really need to do. There's so much changes that are happening, and the only way that we can be able to lead is when we use, using the approach of coaching. So I'm an executive coach, and I'm very, very happy. That's why KIPH is here. We are here really to develop effective, world-class, value-based leaders in these two sectors. Because when I was being trained, I was trained by an engineer as, PMP. And they kept giving examples of roads and constructions and so on. So I'm like saying, as a doctor now, can we bring it closer, where we can now also be able to share our projects, to share things in hospitals, bring it a little bit closer and see the importance of saving lives, because projects save lives. It's only project that you're able to implement whatever we need to do, and projects that are implemented successfully means that more lives are saved. Back to you, Zaitun.
Thank you so much for that story. Very inspiring. And on that note, I bring the first question to you. A question by Kennedy Akani, who said, I have done the 35-hour PMP training. How can KIPH help me to sit for the exam? So that is the first question. Over to you, Dr. Elliot.
Yeah, as long as you did it with maybe an authorized training partner, then we can be able to discuss how now you can register for your exam. But ideally, the institution where you trained, if it's an authorized training partner, they need that certification that they gave you. That's what you need now to register. But we can help you to be able to register. Yeah, thank you.
Okay, thank you. I hope, Kennedy, your question has been answered well. We move on to the next question by Betty Happy. She's asking, is PMD-PRO an authorized training partner for me to apply for the PMP? So I don't know if, who is going to answer this, Madam Maureen or?
I can answer that, I think so, maybe.
Okay.
Yeah, the PMD Pro is another different kind of certification. If you look at my certification, I also have a PMD Pro. It's offered by, initially was being offered by Inside NGO and Humentum. It's a different form of certification. So you cannot use that to register for PMP. PMP, we have said, is the gold standard. It's very comprehensive, and therefore you really need to go through what we have discussed. Start with the training, get that 35 hours of training, then after that you can now register for PMP. Thank you.
Could you address PMD Pro in full?
Project management for development professionals.
Okay.
Yeah.
Thank you for that. Okay. Betty, I hope your question has been answered. We move to Jean Lokenga. So well done, Prof. Njeri. Well articulated. I can't agree more with you on the importance of project management. I would recommend those not yet enrolled to such a certification to do so. In my work experience, PM is cross-cutting no matter the sector you will deal with. projects, PM skills make you more competitive compared to others with no such skills and knowledge? So this is not a question. He's just putting a stamp onto that. Thank you, Jean. Moving on swiftly to Beatrice Jane. I have been in program management and leadership for over 10 years. Wow, that's a lot. I am undertaking a professional development course. How do I enroll in the executive leadership coaching sessions, and what do I expect in terms of time commitment? Yeah, I think this one goes to you again, Dr. Elliot.
Sure. I think we can get in touch on the executive leadership coaching. Maybe there are a few options here. The only thing is to ensure that it is certified by International Coaching Federation or any other globally recognized. So I think that one you can get in touch with me personally, and I can be able to we discuss more on that. Yeah.
Okay, thank you so much for that. Over to Kennedy Mutua. What is the mode of delivery for the training? We have mentioned it is via Zoom, if I'm not wrong. Yeah, okay. So we move on to SCAF Kenya Foundation. If I need a project manager whom you have certified, can you assist in getting one for us for projects in Kenya? How do we go about that? So I presume they are not in Kenya?
Yeah, maybe that one would be also another one we need to get in touch. I mean, you just get in touch with us. I request my support team to put our email there, info@kiph.ac.ke, so that you can be able to quickly get in touch with us and we shall be able to support you. Thank you.
Yeah. Okay. Info at
May I also
Okay.
add, we also have a catalog of all certified project managers and PMI Kenya. So maybe I can also share a link and you can reach out to us on email and we can confirm if the member is in good standing.
Thank you so much, Madam President, for that. Dr. Victor Ngani, thank you for joining. This is one of a good doctors also in our community. Good evening. Does the experience need to be in jobs titled project management? Thank you. I think, okay, Maureen, take that.
No, to be honest, like we said, anytime you're delivering a temporary endeavor, that will definitely deliver an initiative for the organization, a change, a process, etc., technology. That's a project in itself. So in any project, there are very many players. You will find that we require the project sponsor, the sponsor who is funding the project. You'll find we have the owner, the person who at the end will benefit from it. You also have subject matter experts, depending on which organization you're in. So any role that you're playing in that project qualifies you to say you have some experience in project management. The only thing I think that Dr. Eliud was trying to just caution is that when you're required to sit for some of these examinations, they actually test what is your level of experience. You might be new in projects, and if you're new to projects, maybe you only have 0 to 3 years, or you've never actually been involved in a project that had all those 4 facets, which would be initiation and planning, kicking off the project, execution, monitoring it, and closure. So when you don't have all those things, the preference would be that you start from a CAPM. But if you have found yourself in multiple projects where you've done all those things that I've mentioned, the phases I've mentioned, from initiation to closure, then feel free to sit for PMP. You don't have to be called a project manager. In other industries, for example, built environment, a site manager is a project manager. Their role, if you look at the responsibility that they're responsible for, it actually speaks to project management. So yes, no, it doesn't. You don't need to have that title for you to say you experience in project management. I hope that answers the question.
I hope so, Dr. Victor. You can let us know on the Q&A. Thank you for that, Maureen. Stella Kakai, I think also whatever Maureen has spoken about answers you. Kindly elaborate. If one has no experience in project management, has only work experience and a degree, which is the best program to start with? So PMP or CAPM? Definitely CAPM, right, Maureen?
So depends on her experience. 0 to 3
Okay.
years CAPM. If she has more than 3 years experience, I would ask her to go for the project management certification, the PMP.
Thank you for the clarification. We move forward. Grace Gishuna, thank you for joining, Grace. Kindly share WhatsApp link. I hope the KIPH team has shared. Gibbs can let us know. You'll have it by the end of the session.
Let us just share shortly. I think it's being shared.
Okay, that's fine. You'll get it, Grace. Peter Kamau, thank you, Dr. Eliud, and the panelists for this webinar. The information you have put across is very informative. It is interesting to note that even our own lives are projects, yeah? Dr. Njeri, please give feedback for this.
Thank you. I think what that statement meant is that a project being a temporary endeavor that has a start and an end, being by definition, even our lives has got a start and an end. So we got by its own definition is a project. I think from the definition of a project.
Thank you so much for that comment as well, Peter Kamau. And we move to Dan Ken. Hi, Maureen. I'm not new to project management, but I just want to get opportunities in NGO or health project management roles, being in construction, banking, and retail industry. Maureen, this one is for you.
What did you say the name was? Sorry, I didn't hear I just want to address them.
Dan Ken.
Done. Okay, good. So, like I said when I was doing the presentation, this is a transferable skill, and you can transfer it to any industry. So, definitely go for it. We have, if you said you're a certified project manager, so we have our community for project management individuals in Kenya, where we actually share jobs. When people are looking for resources, they do some advertising with us. So feel free to connect with us. I've shared the links to our website, pmi.org. Feel free to reach out to us, and then we'll add you to our WhatsApp group, our social community, and should opportunities arise, you can there for you to take them. So yeah, all the best.
Thank you so much for that, Dan. I hope you are sorted. We also have Job Okemwa saying, I am a medical doctor, currently county tuberculosis coordinator, previously a sub-county medical officer of health in Turkana County. This one is in Kenya, where there is very little information on CAPM and PMP among healthcare leaders in counties. Is it advisable to pursue MSc project management in addition to these courses? So I don't know who will pick that one to answer Job Okemwa.
Maybe I can pick it up. Job Okemwa is known to me. I mean, I worked in Turkana and we interacted. What I would say really is that you can, once you do like PMP, definitely you have the right experience. You have the number of years. I would recommend you start with that. Then once you start practicing as a project management professional, you will now be able to gauge whether you need to have additional, maybe master certification and so on. But I also request Dr. Njeri, who has gone all the way to PhD, maybe also to comment on that. But I would recommend you start with the PMP certification, which will be very, very relevant to what you are doing. And that's what we are talking about. We need the CHMT, the county health management teams to be trained in project management, to be project management professionals, because they just deal with projects. And when you are now doing all that work without this skill set, it becomes very difficult really to deliver on those projects. Thanks.
Maybe what I can add, Daktari, is that there are two levels of learning. When you talk about the masters, like the masters in project management and doing a project certification, rest assured, project management is cross-cutting. Anybody, whether you are a doctor, an engineer, whatever type of profession you are in, the certification is eligible to everyone. But now when you take a different route, like now, if you're a medical doctor, remember, you cannot do project PMP certification and become a medical doctor. So you have to have that cutting edge. For you, first of all, to become a doctor, you have to take that route of becoming a medical doctor. Then from there, you do the certification of project management because you're dealing with people. And then takes us to the definition of two terminologies, project and management. Remember, project is a temporary endeavor. Management is dealing with people. So if you are dealing with people, and of course, all of us will deal with people, whether they are alive or dead, you need some management skills. So take your route, whether you want to do master's or PhD, but the certification is for everybody who is in this world and dealing with people because of the management perspective. I hope I've tried to break it down, but still we can take the conversation to another level.
Wow. Well put, Daktari. Thank you so much for that one. And we want to wind up. I can see Stella Kakai asking for the weekday classes. How many days in a week? Rachel, I can see you answering people down there. You can also put the information there. Dr. Eli, do you have something to just briefly say about that?
Yeah, it's from Monday through Friday. That's the weekdays. And then if at all you prefer to do it on a Saturday, so it is weekdays or Saturdays. Saturdays is between 9 and 1 p.m. And then we do about 12 Saturdays. And then for the weekdays, we do from Monday to Friday for 4 weeks. It comes to about 60 hours. The requirement is 35 hours, but we really want to ensure that you understand all the concepts. So we are even giving you more hours than what is the prerequisite for PMP certification.
Okay, there's one who also asked about the window period between now doing the training and the examination. So I can't see it here. I don't know if that one has been answered. You can also mention.
Yeah, once you do the exam, once you do the training and you get our certificate, then now you need to really revise. Do a lot of reading, do a lot of sample exams, which we are going to be able to share. And then when you feel you are ready, that's the time you register. Like to just give you my example, I did it within 3 months after, I did 1 month and 2 months of revision and I was able to ace the PMP exam. But it depends on how much time you have and how prepared you feel, because if you sit and you are not able to pass, then it is more cost. So it is nice to really take enough time to ensure you are ready to sit for the exam. Yeah.
Okay, and I can see Maureen is doing a good job as well answering this Q&A also on the platform. Plus the WhatsApp link is up also, same on the platform, on the Q&A platform. But I'll take the last, is it comment or question for the day? Joseph Mutero. Thanks, Dr. Eliud and the team. In my years of service, the other challenge with leaders and managers is stewardship and ethics. At Dr. Mwangi, how can this be incorporated? Yeah. Last question for the day.
Actually, the principles of project management, stewardship, is among, and ethics among the areas that we cover. And if at all you also look at the PMI, our core values, we also talk about integrity, professionalism. Therefore, as you become part of this community, we are also emphasizing the same. You saw that our mission is also to develop value-based leaders, because we must be professionals who from in the core, they really want to do well and they mean well for the profession. And therefore, once you become part of this community, it's part of what we shall be discussing, but more so, really we are developing value-based leaders in these sectors. Yeah, thank you.
All right. Thank you so much to our panelists. Thank you so much to our attendees. You've done well to stay tuned from the beginning until the very end. I will do injustice adding more information. I wouldn't want to dilute anything. They've put it well. I'm so grateful to be associated with these geeks, you know, guys, learned people of the society. And we've just learned how project management is important, both to the healthcare system and also the NGO sector as well. So without further ado, I'd like to close the webinar at this. Probably last remarks from our panelists, and Maureen will close with a word of prayer. Thank you.
Mine
Dr.
is
Elliot,
just to
let's
say
start with you.
thank you
Okay.
for attending and thank you for the moderation. It's up to the standard. And to the participants and my fellow panelists, thank you so much for investing time to gather all this knowledge. Let's connect in other platforms too. Thank you.
Thank you, Dr. Also, you can leave information there, your WhatsApp links, your emails. I know they'll be resourceful to everyone. And we can also find the same information on the WhatsApp platform as well. So
Fantastic.
thank you so much, Dr.
Yeah, maybe from me again is to thank all of you for joining and really saying that we shall be doing this every month. We really want to do a lot of webinars around the issues of leadership, governance in these two sectors. That's the health and the NGO. And more so, we have, we really want, you can now start registering for the exam, for the cohort, the training that's coming up on the 3rd of Feb. We have shared the link for the registration, and I wish you well. We are here to develop, again, I want to repeat that we are here to develop effective, world-class, value-based leaders in the health sector and also the NGO. Thank you so much. God bless you.
Thank you, Dr. Elliot, for that. God bless you too. And also, Willis is asking about the registration cost. Willis, you'll find every information on the WhatsApp platform. And also, Rachel has sent the forms just to see the costs, and you can also register on that. Thank you so much, Dr. Maureen, as we wind up, you can also pray for us.
Sincere appreciation, Zaitun, Dr. Elliot, and Dr. Njeri, and to all the members who have attended this session. It's been such an honor. I hope that we have raised or increased your desire to improve yourself by seeking this on-demand certification. I hope you've been able to see how it can grow you as a professional and also how it can expand your knowledge and make you a better leader. I really look forward to the many certifications and the competency that will improve just based on this conversation alone. And I look forward to many other sessions. Please do feel free to connect. Thank you. Maybe we can bow our heads for a word of prayer as instructed. Dear Jesus, we come before you. We thank you for the gift of life. We thank you for the gift of good health. We thank you for the blessing that you bestowed upon us. We thank you for this wonderful session where we've been able to share, we've been able to network, we've been able to learn. We pray that you go ahead of us, that you may bless all our plans, oh God. We pray that since we're doing this at the beginning of the year, we pray that we may be able to reap the benefits of this session and look back on this day and be grateful for such a wonderful session. We pray for Dr. Elliot as he starts his journey as an ATP. We pray that you may go ahead of him, and we pray that you bless the work of his hands. For all the impact that will be derived from the project professionals based on this training, we thank you in advance. In Jesus' name we pray. Amen.
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 Amen. Thank you
Amen.
so much
Thank you.
also to the team that has been able to facilitate this, Gibbs and Rachel. God bless you. Thank you to our panelists and also to the attendees at large. My name is Zaitun Ali. I've been your host and moderator for today. I am a health journalist, very passionate about healthcare service delivery, and not just healthcare service delivery, but quality healthcare service delivery and access to everyone in the community, even at the grassroots level. So until next time, guys, have a lovely evening. Thank you.
Kwaheri.
Bye.
Kwaheri. Thank you.